I'm Christy Erickson. I work for Galen Healthcare. I have previously worked at Allscripts in a variety of roles in my past. I'm also a clinical person. I'm a nurse practitioner by training. So it's my pleasure, again, I'd like to reiterate that, just to present to you the meaningful use selection and configuration. So I am going to do a very high level of the 15 core measures, highlight primarily items from the field from clients that I've worked with through implementations and upgrades. The main purpose of this presentation, however, will be focused on menu selections and clinical quality measures, how to select them, what do you need as an organization. If you haven't done so, what should you consider? If you have, maybe looking back at what you chose, were those the right ones, and reconsidering based on client feedback, based on those menu and clinical quality measures. In addition, I will focus on primarily the clinical quality measures. There's been a lot of questions about how to configure to those, what's delivered, what's not delivered, what are some of the tips and tricks of getting them set up and configured in your system. And then lastly, I'll try to provide some tips of success of user adoption, not only from meaningful use, accepting the 11.2 upgrade and or rollout, and understanding how you can promote that in your organization. So I just want to do a quick recap for everyone. Most everyone on the call, I'm expecting, that knows this answer. But how do you meet meaningful use? So just as a refresher, 15 core objectives every organization has to meet. There's no selection that you can choose. I will highlight those momentarily so that everybody needs to be trained on those. You need to be configured on those. There are 5 menu set objectives that every organization must select. You were offered 10. You need to select 5 of those. And then lastly, you need to have a total of 6 clinical quality measures. 3 must be out of the core clinical quality. However, if you don't meet those, there are alternate core. I will be reviewing that. And then 3 additional clinical quality measures. So that, in a nutshell, is how do you get there? We'll talk about the tools that get you there delivered with the enterprise product. So what is your very first step before, if you've decided and or you're in the process of deciding, or if you haven't decided and you need those tips, or you made some decisions, how do I go back? I have worked with clients who've had to rethink those decisions that they originally made based on the information that they had at the time. So the first object and the best practice that I could recommend, given all the clients I've worked with. Yes?
Hey, Christy, we're not seeing your screens.
South Carolina, so I get to try some of the southern food every once in a while.
I apologize.
Thank you.
Do you see my slide now? Carla, if you can just confirm that you can see my slides now.
Thanks, Christy. We see you.
Thank you so much. So I apologize for that, everyone. So just to reiterate, here's the objectives that I briefly talked about, the 15 core, the menu, clinical quality measure, the configuration around that. And then I will focus on this just because I threw out a lot of numbers, and I apologize you weren't able to see my screen. So I'll reiterate this real quickly. So again, there's 15 core objectives. Every organization has to do each one of those and have a workflow around them. There are 5 menu objectives. There are 10 that are in the set that you can choose from. You must choose 5. And then there are 3 core clinical quality measures. There are alternate cores if your providers don't meet that measure or one of those measures, but you must choose 3 of the core or alternate core, and then 3 additional clinical quality measures. And you have a total of 44 measures to choose from for the clinical quality measures. So I know that's a lot of numbers. We'll walk through that today and sort of how to make that decision process. So this takes me where I was on a screen and none of you were momentarily ago, but what's the best practice? How do you even get started? The best suggestion is to find out what is going on in your sites and your clinics today. what's the best workflow for each site, and what's the role of each site and the end user population. Knowing what they're currently doing today, for those items that you get to select, the menus and the clinical quality measures, it makes it easier to find out, one, what would be the easiest workflow, what also meets the eligible providers, and have an impact that would be easily adopted by end users. Remember, you can configure, you can train, but unless the end user actually does the item, you won't meet those reporting numbers. So before you ever get started, regardless of what version you're on or where you are today, in this process is clearly knowing what workflows are done. Not the workflows that you trained them on maybe a year ago or just 2 years ago or your last upgrade. What are they actually doing today? It will facilitate, and does that vary from site to site? Does one site do it totally different than another? In developing your workflows and or training each one of those sites, it would be critical to know what will be the impact for each one of these. The other is, who's the team that you need? Because you're going to find that there's a lot of clinical information that's in this menu set, clinical quality measures, hence the name clinical quality measures, I do recommend that there is a clinical resource, a physician, a mid-level, even a nurse on your team that helps understanding these workflows and what is being asked. And what's the level or the hierarchy within the organization? Do those menu selections have to be chosen and approved by an advisory board, an EMR committee? Is it an IT team that's making those decisions? And how are they making those decisions? Are they because they're the easiest workflows? Are you going to make 5 menus and everybody has to do those 5 menu items? Or will you configure to all 10, train everybody on them, and let each eligible provider? So these are typically organizational decisions. Will I just do some type of standardization? Here's my 6 clinical quality, here's my 5. Everyone's got to meet them. In doing so, you really need to make sure you're looking at them at a very broad level to make sure you're not excluding an eligible provider who would not make the mark. And that will become clear a little bit later. And then lastly, who's eligible? You need to find out who's eligible in your organization. Part of that is going to the CMS website and understanding that medical doctors, DOs, are eligible for both Medicare and Medicaid. NPs, PAs, mid-levels would only qualify for Medicaid, and they have to have a certain level of Medicaid patients, both for the mid-levels and the providers. So understanding, how do you find out who's eligible? Yes, you may say this is a doctor, but do I decide that he does Medicaid versus Medicare? Pull reports, find out how many patients are being seen. I've seen organizations consider rechanging who gets scheduled for certain patients so that they can qualify for certain programs versus the other. So knowing who's eligible first, knowing who's the workflows, and coordinating that team are the base foundation that you're going to need before you dive into these menus, so you have a clear understanding who's going to be impacted and how much will they be impacted. So let's just start with the core measures. Again, I will not go through each one of the core. The focus is really going to be on the menu and the clinical quality measures today. However, I do want to give some feedback from the field and items that have sort of surfaced as a whole. For the most part, all of these measures that are listed on this screen, and I'll allow people to review that as you're watching the webcast, primarily are simple, straightforward. The number 3 really relates to the clinical quality measures, which we'll talk about momentarily. Number 4 is an attestation piece. So this is not actually something that's reported by a numerator or a denominator, a number value, but more of a provider saying, yes, we've implemented one clinical decision support. Many organizations are deciding how I decide that, how do I know that, what's going to be our clinical priority. Consider it something that you can track. Perhaps you're going to say all women between the ages of 40 and 64 will have a mammogram yearly. And you can do healthcare reminders. You can use the new functionality of population health to evaluate, are they getting that? So the organization can do it based on specialty, by an organization level, or by provider level. of something that would impact that clinical scenario. And the last objective on this screen, particularly number 5, I do want to point out that this is related to download chart functionality. And for those that may or may not have the StimSet in place and or the latest ARN release, which was released in the last 2 to 3 weeks, you will need that in order for this to work properly.